On this episode,
oh gosh, it's huge.
Audrey can't believe what's wrong with little orphan Evie.
What are you? Oh my gosh. I've never seen anything like this before.
See that whole green bit?
Oh my god.
And Kate is shocked at the injury on Sumo's eye.
This is not good.
But first,
This one's not an easy one, Annie. It's about now that I say to myself, why did I start this? But this little dog really deserves a decent life.
It's all right, baby. It's all right. They're nice here.
at Rob's practice near Sydney, Greta from Jack Russell Rescue has arrived, desperate for help for a very special little dog that no one wanted.
Lionel came in from one of the Sydney pounds. He was so scared, so timid. He was extremely underweight and he sat hiding behind his kennel. He was too afraid to come out. But we knew he was really underweight and he was hunched over. It's a bit scary. It's a bit scary. We get Jack Russells from all around Australia, but he was one of the worst that we'd seen in terms of condition and his inability to walk properly. You couldn't get near him. He would curl himself into a ball, wet himself when anyone came near him, but he didn't like anyone near his head. Come on, mate, let's go. But he was so scared we couldn't see exactly what was going on. The timid dogs, like Lionel, always make me feel sad because you wonder what's happened to them, what sort of life they've had. He's a good boy.
So I got a call from Jack Russell Rescue and they said they had a very timid dog but with an unusual problem in the back legs. I'm not sure what they were, but look, those welfare dogs, they just ring in my heart. So I'm happy to help them. Let's find out what's going on. Hello, Greta.
Hello.
Hey ho, who have we got here?
This is Lionel.
Oh, I heard he's a little bit timid.
He is.
Hey,
He's
baby.
very timid with new people.
It's all right, darling. Oh. So knowing that Lionel was timid, the last thing I do is rush in and put my hands all over him. Just take it steady. He's very cute looking, isn't he?
He's gorgeous.
Well, let's go find out what's wrong with you, Lionel. Come on.
Come on, mate. Let's go.
Easy goes and just slowly win his confidence. Show him I'm not going to hurt him. Okay, just pop him up there for me.
Here we go.
So what's been going on? What's wrong with him?
He came in from one of the pounds, and we've had him for a couple of weeks now.
Yes.
He's not able to walk very well.
Oh,
he was
have you done something?
He seems to walk on the on the bottom of his legs. He can't seem to straighten up.
Right.
We've wondered if he was kept in a cage. Or
But
if
they passed him as being okay?
they passed him as being fine.
Okay, so maybe something traumatic has happened since.
Yeah, possibly. When he first came in, the way his feet were and the way he was so hunched over and underweight, we thought he may have been living his life caged. He didn't seem to know what a lead was. He was timid of walking on grass.
Let's check him out all over first. Make sure he's good and healthy in every other way, Lionel. He's a timid little thing,
Isn't he? He's very timid.
He's a good boy. Good heart, good lungs.
That's good. That's good.
Swap areas and we'll just have a feel of these legs.
right.
Just hold him there. This
Yeah.
may hurt if it's a cruciate or something he's done.
Come on, darling.
So right leg is lovely, it's normal.
Good.
Oh my gosh, this is baffling. What the hell's that doing over there?
Okay, all right, moment of truth. Let's find out what's going on. What are you? Oh my gosh. I've never seen anything like this before.
So we're here to fix you up. We are here to fix you up.
In Sydney, wildlife carer Kristen has brought 1-year-old Wallaroo Evie to see Audrey.
Hi, Kirsten.
Oh, hi, Audrey. How are you?
Good. How are you?
Oh, look, not so good.
Not too good. The face looks good though.
It's much better.
Evie was found a while ago standing in the middle of a paddock, disorientated, alone, and we don't really know how she ended up there, but she had these nasty wounds and fractures. We have a few theories about what may have happened to Evie, and I think fox attack is high on the list. When I first saw her, we were focusing on the broken arm. We managed to splint that, get it to heal, and then we noticed that she had some weird scars and scabs all over her face, which turned into massive abscesses. So we got her through that journey. We did a general anesthetic, drained her face, reconstructed most of her nose, and it's been smooth sailing for the last couple of months. And let's go into the console and have a look. All right, come on in.
Thank you. So here we are.
Here we are. All right, Evie.
There's a huge lump in her groin. Oh, come on, sweetie.
Okay.
So you,
Move that away.
come on. When she stands up, you can see the bulge as well.
Oh gosh, it's huge. So Kirsten, when did you first notice this lump?
I think maybe beginning of this week when she didn't want to finish her bottle. So I put her on my lap and then I saw suddenly, oh, there's something sticking out.
It's a massive lump on the inside of her leg. I'm blown away with the size. I don't know where this has come from. It feels firm, it feels warm. I'm just baffled as to what it could be. Could it be something like a hernia, so a tear in the muscle and intestine or fat is coming through? Could it be a tumor? Could it be a cyst? Oh gosh, it is huge. Oh no.
Oh my gosh, this is baffling. What the hell's that doing over there?
Near Sydney, Rob is immediately alarmed when he feels little stray Jack Russell Lionel's bad leg.
I'm trying to work out where his kneecap is sitting. I can't quite work it out. Now I've got bones running in different directions. I wonder if someone's kicked him or something. Really, I'm very worried for the welfare of this dog now.
Oh, baby.
It's just...
Oh.
Let's see if he'll walk for us in here. He may not, but we'll just give it a try.
Okay.
Come on, buddy.
Come on, sweetheart.
Here
Let's
we go.
pop you down.
There we
You
go.
all right? Come on. Ready? Come on. Good boy.
So when I do see him walk, all of a sudden it's definitely the knee, because the knee is pointing in all different directions when he tries to walk. Yeah, the dog's in trouble. But this little dog really deserves a decent life. We owe it to him. He didn't ask to be brought into the world. Well, this is really crazy weird. Nothing seems to be in the right place. We need some x-rays to get a diagnosis and then see whether we can do anything at all, if possible surgically, to help this little boy. Time to x-ray and try and locate where everything is and see if we can put it back together. Yep, x-ray. Wow, what is going on here?
Gosh, it is huge.
In Sydney, a large lump has suddenly appeared on the inside of rescue Wallaroo Evie's leg. Audrey is concerned that it might be a nasty hernia or tumour.
You want to go back in your bag? I'm making a bit of a plan in my head because I don't know exactly what's going on. Have a bit of direction, but I need more diagnostic tests. And if it is good at the moment, it can turn pretty nasty quite quickly, because anything that's out of the body cavity can essentially die off or become constricted. So I reckon we'll try and take one x-ray, just rule out it's not connected to anything like bone or pelvis, and then probably just open up the skin and have a look at what's underneath there. So I'll take it to the back
All right.
and give you a ring when she's in recovery.
Of course, I'm concerned that she's undergoing another anesthetic, but I really hope that she's coming good the other end. It is heartbreaking to see the suffering, but we have to tackle it, we have to address the issue, and the sooner we do it, the better it is.
Here we go again, hey? Here we
got
go
it?
again, yep.
Just clean out this stuff.
All right.
All right, I see you later.
Hi, Mama.
Take care, little girl.
Brave girl. Hey, we'll see you on the other side again.
Okay.
Evie's had some sedation, so she's nice and relaxed. I've got her on the x-ray table to have a better feel. And it's still baffling because even though she's relaxed, this lump is still huge. It's not falling back into a hole. I don't even know what that is now. Feels really hard. No idea.
Audrey's hoping X-rays will help shed some light on the mystery lump.
All right, X-rays. X-rays are up and I can see this cloudy lump where it is, and it's a puzzling mystery. Okay, so we know it's either soft tissue or fluidy. It doesn't have gas in it, which makes it less likely to be intestines. I don't know.
Wow, what is going on here?
Near Sydney, Rob can't believe what he's seeing on the X-ray of timid little Lionel's knee.
I haven't quite seen an abnormality like this or this bad.
Rescue volunteer Greta immediately noticed Lionel's painful, abnormal leg when the abandoned little boy first arrived at the shelter.
When he came into us, he was so scared. We could see he wasn't walking properly. He's still not able to really put weight on his back knee. That's the problem.
It's not trauma. This puppy was born with this problem.
Okay.
This is his normal knee. This is the bottom part of the leg, the tibia, the top part, the big bone is the femur, and there's his kneecap sitting nicely. When you look at the left leg, where's the kneecap? And in fact, it's there, you can sort of see it there, almost looks like it's inside the bone.
Hearing from Rob about how bad his knee is and that it's one of the worst he's seen, just fingers crossed that, you know, we can do something for Lionel.
Now, with your permission, I'd like to take him straight to surgery now, if that's okay with you.
Yeah, absolutely.
Look at his eyes, it just melt when you look into his eyes. He's saying, please, can you do something? Yeah, I'll do my very best for you, Lionel. We'll get in there and try and fix this. You darling dog.
See, there we go, we can see it. See that whole green bit? Oh my God.
Good job. Oh, so good. Such a good girl.
In Bondi, Kate's first patient is British short-hair cat, Sumo.
So Sumo came to see me today. I did notice that she was holding her eye closed and it was quite painful.
Owners Claudia and Andy are worried about the 18-month-old's nasty-looking eye.
She woke up with a swollen eye, and it looks like there's a bit of infection in the eye. So we're getting that checked out.
Just a bit of dye in this eye.
Kate suspects Sumo may have a painful ulcer and is using a special dye to check for any irregularities.
So this is Sumo. She has a crummy eye. She's had a bad eye for a day or two, and I'm just having a look at it. So this is just a little UV light, and this enables us to be able to actually have a look at the eye and say, what is wrong with this eye? How deep is the ulcer? And how extensive is it? This is the thing about ulcers, right? It's so easy to miss them because they hide. So as soon as it's too sore, that little third eyelid pops up. Okay, there we go, we can see it. See that whole green bit? Oh my God. And yes, it turns out that she has a whopping great ulcer on that eye.
I don't know.
In Sydney, X-rays on rescue Joey Evie's mystery lump are inconclusive. Audrey's worried the lump could be a constricted hernia, or worse, a deadly cancerous tumour.
Only option now is to really do some surgery, open it up, have a look at what's going on, get a better idea. Okay, all right, moment of truth. Let's find out what's going on. What are you? Peekaboo. I don't know what it is. Massive ball of muscle. So it's not intestine, it's not bladder, it's not a cyst. All I'm seeing is a bulging piece of muscle. I'm gonna do a fine needle aspirate and see what we get out. Let's pass. Oh my God, there's a giant abscess in her muscle. Oh my gosh.
Good boy. Come on.
Near Sydney, Homeless little Jack Russell Lionel has touched Rob's heart, and he wants to do everything he can to try to save the shy little dog's deformed leg.
I mean, dogs are amazing creatures because they're not like us. For us, if there's pain and suffering, we want to lay in bed and feel sorry for ourselves. Lionel says, it's okay, I'm getting on with life regardless.
Lionel needs major surgery to ease his debilitating pain, with rescuer Greta hoping he'll then have the best chance of finding a new home.
Leaving Lionel with Rob to have the surgery, and Rob said it's a big surgery, it's not a small thing. It's pretty scary.
So, through the skin now, and there's the kneecap, Eureka, there it is. I'm nervous in this because this little dog's life and his leg is in my hands. How this little dog has functioned all this time with that is beyond me. We've got a big surgery ahead of us to try and restructure this whole knee. Look at this, there's no, that should be a big groove in there, a great big groove from that side and that side. There's nothing there, it's all round. I had to start from scratch, really dig into this bone. Literally put a groove in the bone to fit the kneecap. This one's not an easy one, Annie. It's about now that I say to myself, why did I start this? Not a knee as anyone would ever know it.
Oh my God, there's a giant abscess in her muscle.
In Sydney, Audrey's shocked to discover the huge lump on rescue Wallaroo Evie's leg is a massive infection in the muscle. It needs to be drained urgently before infection spreads around her body.
Abscess drainage surgery is my ultimate favorite surgery. Nothing more rewarding than all this pus and infection coming out of the body. So today, dream come true, I get to pop it, get that pus out, and have a look at that thick caseous infection. We're into the abscess because it's too... Oh my gosh. It's, yeah, very smelly. This is one of the grossest abscesses I've had to drain. There must be about 150 mils of this thick green pus sitting in muscle. I think she's going to feel a lot better with that out of her body. We'll culture that, find out what bacteria is in there. Wow. Wow, Evie, just wow.
The amount of deadly pus trapped in the muscle is staggering.
There's more. Oh my God. So I've drained out all of the pus, given it a good clean, stitched it up, and now we can wake her up and get her home to mum. Okay, antibiotics done, flush done. Wake up, baby girl. Good morning. Yes. What's happened? Something's happened. Hey. Yeah, you're gonna be a little bit sore. You got a nasty infection out of your leg. You made it through surgery. You're going to be feeling a lot better.
This one's not an easy one, Annie. But this little dog really deserves a decent life.
At his practice near Sydney, Rob is desperately trying to repair little stray dog Lionel's badly deformed knee.
And that's not easy because I could easily cut into something called hemorrhage. Started growing as a baby and it's been years in the making, so we're trying to reverse a lot of time.
If Rob can't repair Lionel's leg, he may have to amputate.
All right, so now we've got a bit of a groove for this patella to sit into. You know, we can see where things should be. We realise where things are. It's a matter of we can see what we can do. Okay, I'll just have to go for it about there. So far so good. We've stretched the ligaments over. The patella's sitting where it should. What I have to do now is chisel that bit of bone off and relocate it inwards to get a straight line. I don't know if we're going to be able to do that yet. Okay, so we've got it there. We've achieved a straight line with the bones. Look, initially when I opened up and I had a look and I thought, what am I doing here? But on completion of the surgery, I'm really happy for Lionel. I think this is going to go quite well for him. So I've achieved what I thought was going to be the impossible at one stage, but everything's come together really, really well. I'm really happy with this surgery.
After marathon surgery and lots of doubt,
You're a good boy. You just rest.
Rob is finally, cautiously feeling confident.
Lionel did not ask to be brought into this world. He's just a beautiful soul, and yeah, he's had a rough time. To be able to help a dog like that, wow. I feel I've been blessed. I love it. Hey, Lionel. Oh, you're beautiful. You're beautiful. Yes, you are. You're a good boy. When I see you running around, then I'll be extremely happy.
See that whole green bit? Oh my God.
In Bondi, Kate has just discovered that rescue cat Sumo has a massive ulcer on her left eye.
This is a really bad ulcer. This basically takes up a whole cornea, so the whole front of the eyeball is damaged. Those things can be an absolute bother to get better, even to a point that sometimes they can lose their eye. So what I need you to do, Cleo, is take a picture so we can see how bad that is. Oh gosh. This is not good.
It's time to break the news to Claudia and Andy.
She's been a very good girl. She looks sad. She is pretty sad. So that left eye has a giant corneal ulcer. So the reason that she's holding it closed so much is because actually the whole front part of the eye has come off. If it starts to get worse, we need to catch it early. Eyes can go bad very, very quickly. And as you can imagine, we don't want to lose this eye, which is the worst case scenario. Right, so this is her eye, and this is with some dye in it. And you see that mark on the front of the cornea there? Yeah. So that's basically where all the top layer of the skin actually come off. So the risk with these is that they can get deeper. And as you can imagine, when they get too deep, you know what happens. That the inside of the eye comes to the outside, which is not good. And then we can't save the eye. So the plan is to not let that happen. Today what we're going to do is we're going to medically manage it. So we're going to start some antibiotic drops. We're going to use some pain relief because this is really, really scratchy, and some anti-inflammatories. And we're also going to use a lot of lubricant. You know what this would feel like, because I've had one, is it feels like there's sand in your eye. So it's very irritating to the eye. I actually had a corneal ulcer on my eye. So I feel really sorry for these cats and dogs where this happens. Be careful of your eye. She's such a good girl.
Kate's confident Sumo's eye will heal in a few days.
Hi, Sooms.
She's a little mad at you at the moment.
She really is, isn't she?
Bye.
See ya. Bye, guys.
We made it through surgery. I'm going to be feeling a lot better.
In Sydney, wildlife carer Kirsten is anxiously waiting to collect her little Aussie battler, Evie.
Hi, Kirsten.
Oh, hello.
Look who's waking up. Say hi, Mama. It was a long surgery. Okay, let's get you in the consult room. Tell Mummy what we found. Okay. I'll pop you down here. He's still waking up, still very groggy, but everything's gone very well. So, Mum, I'll show you the wound, and I'm going to tell you it was not a hernia. See that the lump is gone now, so that's the incision there. We had to cut open the muscle. It was an abscess.
An abscess.
And it was sitting right between her muscle fibers. I've never seen anything like this before. So we actually cut open the muscle, and then there was this big cavity where all this pus was sitting, and it was just probably about 150 mils of pus.
150 mil.
So she's got an infection within her muscle. It could have been a bite wound. And I think the reason why it only popped up now is because we've finished the antibiotics for her face. So good news is all the pus is out. We've really flushed it out. I've given her an antibiotic injection. I've got the swab because I'm going to send it off and find out what type of bacteria is in there, because we want to give her the antibiotic that treats that infection so it doesn't come back.
All right, Evie, you be good.
Thank you so much.
Yes. No more
So,
nasty surprises.
If you wouldn't have reacted, or if you wouldn't have intervened, what would have happened?
That would have gone to the bloodstream really bad.
Yeah, no
Really,
chance
really
then.
bad. That was one of the nastiest abscess I've seen.
Thank God to vets like Audrey. With their help, we can get the animals hopefully fixed up. Evie's really a fighter, and hopefully we get her through this problem now. Oh, thank you. I just carry her like that. Oh well, it is what it is.
It is.
That's what we do for the animals.
It is. Yes.
Okay, thank you.
All right.
Bye-bye. Bye.
3 days after Kate treated Cat Sumo's nasty eye ulcer, it's fully healed, and the 18-month-old British Shorthair is back to her cheeky self. And an update on little battler Lionel. After marathon surgery to repair the young stray's badly deformed knee, Rob says he's healing well. After a tough start in life, it's hoped the gentle little boy will soon be well enough to find a loving forever home.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way. That way.